My name is Anat Loewenstein. I am the chair of the Department of Ophthalmology in Tel-Aviv Medical Center in Tel Aviv, Israel.
Please tell us about your presentation on home OCT.
I've been involved for many years with the development of a home OCT. As you know, one of the big burdens for patients, physicians, and the system is the fact that they need to come almost monthly to have a test done if they have macular degeneration and be seen by a physician. The home OCT actually eliminates the visits that are non-treatment visits because the patient can be monitored at home. All the data is mounted on a cloud and then analyzed by AI to detect a change in their fluid level to the amount that warrants treatment. The physician gets an alert when the patient needs to come and get the treatment. So we presented many presentations over the years about the home OCT. Today we showed also how beneficial it is to reduce the burden on the patients and on the physicians in a very good manner. This topic was even more important during the COVID-19 pandemic when many patients actually stayed at home and did not want to come to the hospital. So a home OCT can be a solution for these patients. In addition, what we also did during the COVID, we also went and injected inpatient homes for patients who could not come for an injection, because it was so important for macular degeneration patients not to miss a visit so that the visual acuity will not be reduced. So I believe that ophthalmology needs to adapt to the digital area and be kind of supportive of technologies that allow us to do the tests at home and maybe also, for many cases, treat the patients at home.
Where is this service available?
So actually the technology has been developed in Tel Aviv. However, most of the use of the studies are done in the United States, and because you need a monitoring clinical center that actually gets the data and alerts the physician. So it is pending FDA approval, and it has also a code for reimbursement for the physician.
Are these trials ongoing, and how can someone get involved?
Yes, of course, everyone can be, every patient with macular degeneration can be involved in the clinical trials. You would need to address your retina specialist, and the retina specialists are aware of the trials going on with the home OCT.
What are the next steps in this trial?
The next step would be to validate the effectiveness of this technology in preserving or improving visual acuity in a longitudinal trial, and this is currently ongoing in collaboration with some big pharma companies, and also to get FDA approval and to get it available for every patient with macular degeneration. This way we will be able to save efforts of the patient and of the physician to the necessary treatments, and thereby also increase compliance.
Are there any other home diagnostic testing available?
There are other technologies also for home monitoring, looking at functional outcomes. There is the preferential hyperacuity perimetry that is commercially available in the United States for use of patients for detection of the beginning of macular degeneration in patients that already have a disease in one eye, and in the other eye have just dry AMD. So this technology is commercially available in the United States. And there are other functional methods to check visual acuity at home, but the home PHP has been validated in clinical trials.
When can we expect these services to be available to the general public?
So the PHP is on the market, and you can currently have it at this moment. And for the home OCT, I think it will take some time, but not very long. I would say maybe, just as a guess, around a year.
Is there anything more you'd like to share with us?
Well, I think that for macular degeneration patients, there are a lot of new advancement that happen now in ophthalmology, using AI to predict when will be progression of the disease, which patient will respond to which treatment. We have new treatments coming up with longer duration. We have slow-release devices, and we have treatment for non-neovascular disease, for dry AMD, that is pending FDA approval, and we are really looking forward to see how it works in real life.
Professor, thank you for sharing these exciting services and information with us.